we're going to shift gears now, and we're going to go into fingernails. And we all notice our fingernails. They get long, we clip them, they get dry, they get brittle, they crack, they have pits, they have grooves, they have all kinds of crazy things going on. And I tell you, it all means something. And so one of the first things and one of the most common things we see is what we would call a longitudinal ridge. And it's a classic sign of a vitamin B or a magnesium deficiency, chronic dehydration, just improper nutrition.
Vitamin F.
And one of the other big things is what we call vitamin F. Vitamin F is your essential fatty acids. It's your omega-3s. It's the good fats that we're not getting. And so if you're eating hydrogenated oil, if you're eating fast food of any sort, you're not getting the good oils or the good fats that you need, and you're gonna observe these longitudinal ridges. And so when we look at those ridges in your fingernails, you got to change your diet. You got to get these things back into your diet. And so we recommend standard process has a cataplex F. Often there can be a thyroid factor into this hypothyroidism, which of course then we take the thytrophin, protomorphogen, the PMG, or sometimes the organically bound minerals, which are necessary. Food, we like butter. You got to eat real butter. We found that the healthiest and the best tasting butter that we use is called Kerrygold. It's from Ireland, and we find that there is less pollutants or toxins in that than even the organically grown butter here in the United States, because Ireland is an island and everything, any pollution just blows away. And so again, it's much cleaner. So we use Kerrygold butter. We use fish, salmon, mackerels, sardines. You realize that sardines is not necessarily a specific type of fish, but it's a particular size of fish. And so when you get sardines, it's just a fish that's under 6 inches long. And so sardines is super healthy. Flaxseed oil is very good. Seaweed, seafood, Brazil nuts. You should be eating a handful of nuts every day, as outlined in our law diet checklist that we have. Apples, eggs, whole grains, berries, dark chocolate. When you eat dark chocolate, and we recommend over 70% chocolate, we tell people this is a nutritious supplement, high in magnesium, very, very healthy. If you buy Hershey's or Nestle's or one of these other chocolates, it's got 10 or 11% chocolate in it. The rest is sugar and who knows what else. But you eat good quality chocolate, and you don't need to feel guilty about that. The next thing that we see, and this is also very common, is we see white spots on the nails. And sometimes it's just one or two spots. Sometimes it's multiple. If you don't know of a traumatic incident that caused that white spot on the nail, chances are it's a zinc deficiency. And so standard process, we have a zinc liver chelate supplement that we use, but also red meat. We'll give you the zinc. Shellfish, legumes, seeds such as hemp and pumpkin, squash, sesame seed, flax seeds. Pine nuts are good. Peanuts, cashews, almonds. So lots of nuts are going to help with that zinc. Raw milk, the only type of milk you should ever be drinking, in my opinion, is raw milk. If we can't get raw milk, we don't drink it. We use the almond milk or one of the others that can be good. We make our own cashew milk. We've got a YouTube video on that is excellent. And so the other thing that we see very common is cracked brittle nails. And so if you've got that little crack in your nail and you keep trimming it back and you're trying to get beyond that crack, and I'll tell you, it's a nutritional problem. Often it's associated with the decreased stomach acid. And so taking a digestive aid such as Zypan or apple cider vinegar can help. It could also be associated with fungal infections. And so you look at the hand with the four fingers there. three fingers and a thumb, and you can see some fungal infection, developing there. Again, the healthy fats, and so those are all important there. So when we talked about fungal infections before, we talked about garlic. We talked about garlic forte as a supplement. Again, the essential fatty acids. We like the tuna omega-3 from Standard Process, or the cod liver oil. Those are both very, very good. So next we look at fungus in the nails. Actually, much more common in the toenails than in the fingernails. Right? You've got that person who, male or female, fungus is no discriminator of persons, who does not want to take their socks off. They don't want to go around barefooted because their toenails are scary, gnarly, fungally messes. But we see it in the fingernails as well. And again, when we're looking at fungus in the fingernails, it's usually a big indication that the good bacteria, the probiotics, are not well established in your body. And so that's the first order of business, is we've got to get the good bacteria into your body. We talked about using different probiotics earlier, but the prebiotics are also important. You need to heal the digestive tract. You can try all kinds of things topically to help that fungal problem, but really the only way to deal with it adequately is from the inside out, and change the whole complexion and nature of the digestive tract. Some of the medicines that they use, that you'll take in orally, again, they're killing it from the inside out, but they're doing it with drugs, and there can be a lot of negative consequences of that. When your podiatrist or your doctor gives you a strong antifungal to kill the fungus in the nails, we've got to keep close tabs on the liver, because it can absolutely damage the liver, because the drugs can be so hard and so harsh. And so when there's fungal problems in the nails, we use a probiotic. Standard Process ProSymbiotic is a good one. We also use lactic acid yeast, which helps to acidify the large intestine so that the good bacteria can grow and be established there. A lot of people think that their digestive tract, they want to be more alkaline. But what they don't understand is the body drives its chemistry through changes in the pH. Your mouth should be alkaline. Your stomach should be acid. Your small intestine should be alkaline, and your large intestine should be acid. It's that change and that shift from acid to alkaline, or alkaline to acid, that again drives the chemistry, and that's very, very important. And so when these people are just trying to totally alkalize their body, they're mistaken. They're off base. And so next we look here at what we call a gnawed nail, and you see people with this, and this is the person who's biting those fingernails, and it just, look at this poor guy. He's got them down to nothing. If there was anything more of that nail coming out, he'd probably bite it off in a heartbeat. And so again, this is a sign of anxiety, obsessive compulsive disorder, and these can be nutritional as well. And so often we find that if we can get somebody to turn their nutrition around, Standard Process recently came out with a new product called Easy Mag, and it's a powder that you mix with your water or your smoothie or whatever. But we've seen some great results in reduction of anxiety and just calming down of that emotional behavior. Minchex is another one that we use of Standard Process that really helps. But understand that many of the psychological, emotional disorders and things that are going on can be greatly helped with nutrition. And so that's something to be aware of. Next we have what's called a pitted fingernails. And you notice these nails here, there's pits. It's almost like somebody had a sharp instrument and just poked a bunch of holes and dented the nails there. Common in psoriasis or psoriatic arthritis, which is kind of like end-stage psoriasis. Psoriasis, that skin problem, that rash that you get around the elbows or the knees or the hairline, which again is a liver issue, and so we need to deal with that. But this is pitted fingernails also associated with osteoarthritis, which is called degenerative or wear and tear arthritis, often associated with an autoimmune disease, and there's lots of autoimmune diseases. When I was in school over 30 years ago, there was a handful, less than a dozen autoimmune diseases that we've talked about. Now they're approaching 200 identified autoimmune diseases. So you see pitted fingernails. This is a person who is not healthy. This is a person who needs some serious intervention, if you will. And so when we look at pitted fingernails, we've got to turn things around. We tell people our Three Kings formula, dermatrophin, ostrophin, garlic forte, imuplex, all standard process. Our Three Kings is very important. We avoid sugar, alcohol, fried foods, tomatoes. We eat fish. Again, that healthy whole food diet. When we talk about a whole food diet, we're talking about a plant-based whole food diet, and it's not to be confused with a plant exclusive diet. And so I really do not support a plant exclusive diet, but more of what we tell people: you should be a vegetarian that cheats once in a while. And so cheating once in a while, if you look at the longevity studies, cheating once in a while means that they're having, red meat or poultry maybe 5 times during the month. They're having fish, 2, maybe 3 times during the week. They're eating salmon, they're eating sardines, they're eating, things that are going to specifically build the nutrition. And the research and the literature absolutely, supports all of this. And so that's important as well. The next we go to a clubbed fingernail, and it looks kind of creepy here. But look at the top 2 squares where the person's putting their fingers together, and you see the normal. You put those knuckles together, and so do that, and you should be able to touch your fingernails together. The person with the clubbed nails, they put it together, and their fingernails cannot touch, and so this is associated with low levels of oxygen. From the lung, affecting the heart, the liver, the inflammatory bowel problems. Again, this is somebody who is really sick. This is somebody who's got problems, and so you see that swelling in that last digit, and so that's club fingernails. Again, this is somebody that needs to really buckle down and shape up. And so one of the supplements from Standard Process that we really like is Cataplex E2, and it's got selenium in it, and really one of the things that it does is it just increases the oxygen carrying capacity of the red blood cell, and that makes a huge difference. We've got athletes, we've got mountain climbers that will be popping the Cataplex E2 to increase their oxygen availability, during their stressful workout. The next one here, and this is actually fairly common, what's called a spoon nail, and it looks like somebody has just scooped the nail out. Often the nails become very, very thin. It's associated with an iron deficiency, which again is anemia. So you can look at the person's tongue. Another way to check for anemia is you shine a light behind their earlobe. And if it's not red enough, you almost need 3 or 4 people to shine the light through all of their earlobe. And if you got the one guy that, man, that's not very red, then we can suspect anemia. Someone with spooned nails is got a low immune system. They're the ones that are getting sick all the time. And so, again, we want to build that up. We want to take something like Pharaoh food or Congoplex for the immune system. We want garlic forte. We want to build the immune system. We want to build up the blood. We do that with red meat. We do it with shellfish. Again, the issue with shellfish again is quality, right? And so finding shellfish that's not toxic can be tricky. I tell people do the best that they can find and afford. Dark leafy greens. Livers and other organ meats. someone was telling me they hated kidneys, and I've never had kidney, but they say it has a real metallic taste to it. And I thought, that's interesting, which suggests that there's a high mineral content in the kidneys. And so, beans and garlic. Beans are probably one of the healthiest foods that we can put into our body. Very anti-cancer. It's a superfood. Do not buy into the nonsense of lectins. Yes, beans have lectins, but you cook them. We don't crunch on hard, dry beans. And those are the ones that have all the lectins. You cook beans thoroughly till they're soft and delicious, and you've taken care of the lectin problem. There is a little bit of lectins still in beans after they're cooked, but what they find is the lectins and the small amount and the type that are left in beans are some of the primary cancer fighters for colon cancer. And so again, nothing but good about beans. And so don't buy into the lectin nonsense that's floating around on the internet. Yellow nails. Respiratory conditions such as chronic bronchitis. I used to think that smokers, had yellow nails, and they did, but it would seem that the yellow nail would be associated, I thought, because they're blowing smoke onto their fingernails or something. But look at the other hand. Those nails are yellow too. And so when we're dealing with yellow nails, we're dealing with chronic respiratory type problems. And so it's not necessarily just smoking, but again, you're going to see that on both sides, not just on the side that the person may be holding the cigarette. And so when we're dealing with these respiratory things, the Cataplex E2, we use a supplement, a protomorphogen from Standard Process again, called pneumotrophin, spelled with a P-N-E-U, like pneumonia, for the lungs. But also Brazil nuts, mushrooms, seafood, beans, liver, whole grains. You see the pattern with the food that we're talking about? A lot of the same foods are going to benefit lots of different things. The next slide that we have here is what's called half and half nails. And this is something I actually see in my office here. And so you've got the white part going literally about halfway up the nail. And this is a sign of kidney failure or chronic kidney disease. And so when we're dealing with that, we use the Renatrophin PMG or the Renafood. We eat foods like cauliflowers and blueberries, red grapes, eggs, garlics, buckwheat, and so forth. And so it's important to again get that good nutrition in. I had someone just last week tell me that her kidney function was down to 30% when we started with her, and she just had a test and it's up over 50% now, and she's thrilled. And so again, what we want to do is we want to turn that around. And so for her, an easy way to gauge that is by looking at her fingernails. How's my kidneys doing? Look at the fingernails. And so again, when we understand some of these signs, it's real important. The next one here, lack of a lunula or no moons. And so if you look at your fingernails, you can see that little moon or that little, it's like a moonrise, coming on. And ideally, we want to have 8 of those. It's a sign of anemia. It's a sign of oxygen in the body. Again, poor nutrition, depression is associated with that. So we want to look at those nails. And I was teaching a class to a senior group several weeks ago, and one of the ladies say that I have 10, and I thought that's phenomenal. I only have 8 myself, and she says, but what I do is I do my deep breathing every day, and I'm convinced that's why she had 10. Another person said, I have 10 too, and I do deep breathing exercises. And so, again, getting that oxygen into the system. We look at bluish fingernails. This is an interesting one, isn't it? No fingernail polish needed here. And so, again, lung problems, poor circulation. This is also the person, you look at their lips, and they've kind of got that blue tinge around their lips. They've got to get some oxygen into their things. So again, Standard Process supplement, we'll use pneumotrophin, we'll use the Cataplex E, we'll use soybean lecithin, which will help with the circulation. Food-wise, your nuts, especially Brazil nuts. A lot of people don't like Brazil nuts, but they're probably, all nuts are healthy, but Brazil nuts are not to be picked around. Eat those too. Next here we look at plumber's nails, and this is when the nails are actually separating from the bed. And it's associated with hyperthyroidism. Most people talk about hypothyroidism, but this is hyperthyroidism, iron deficiency. You could have an injury. I remember smashing my finger once, and you know, I lost the nail. You see this with runners with their toenails, and so those nails are going to be more vulnerable for infection. And so again, hyperthyroidism, iron deficiency, fungal infections, and we treat those appropriately. And we again, diet. Look at the chart posted along with this video will be a handout that you can download. I don't know if we'll have it on the YouTube, or probably a link where you can come to our blog and download that chart. Terry's fingernails. This looks real similar to the half and half nails, but it goes up about 3/4. And again, this is a sign of liver disease. If you've got diabetes that you're not managing or controlling, congestive heart failure. Again, you see those half and half nails or Terry's nails, and you've got somebody who's sick. You've got somebody who really needs some attention. And finally, with our nails, we have what's called a Bow's line, bow, B-E-A-U-S, and it's a sign of malnutrition, meaning that your body says, you know, I just don't have enough good nutrition to put to make these nails, and so you have these transverse lines that go across. Often you'll see a wavy or a bumpy ridge that goes. Again, we see it with our patients who are undergoing chemotherapy, poorly controlled diabetes, heart concerns. Again, this is somebody who needs some nutritional intervention, and so we've got to do more than just take this supplement or that. Sometimes it's just you need more B vitamins or zinc or magnesium or whatever. But this person needs the whole picture. When we observe, and so we're done going through our signs here, and let me just close up by saying, when we observe the skin, the hairs, the nails, the tongues, these are all true and accurate signs that of your health. This has been documented in the JAMA Dermatology Journal of American Medical Association. It's research from Mayo Clinic. You can go on WebMD and you can look all this stuff up. It's absolutely legitimate. It's not the crazy chiropractor who's making stuff up for you. And so again, what we want is we want things that's true and accurate. Again, as I mentioned earlier, we either take the supplement or we eat the food. But you've got to do something, because the signs and symptoms, you see the crease in the air, you see this in the ear, the spider veins in the face, you look at the fingernails and the tongue, you look at all these things, and you need to understand the body isn't lying. And so it is designed to alert us when something is wrong. And so it's important to understand that there is much that you can do on your own, and a lot of it is turning back to the things that you already know you should be doing. And so if you're not eating healthy, if you're not taking care of yourself as you should, shape up. I'm not your mom, and I'm not going to police you, but you got to grow up and start being the adult and start taking care of yourself, or suffer the consequences. And the choice is entirely yours. We have the freedom here to make whatever decisions we deem are the best, but we don't have the freedom to choose the consequences of the decisions that we make. And so again, I admonish you, take a look and spend some time analyzing yourself and the ones that you love, and see what you need to do. And I hope this was helpful for you. If you've enjoyed this video or any of our others, share them with others. Again, our goal is to help people. We want people to get well as quickly and as economically as we can. We do that through good nutrition. We do it through good lifestyle practices. And thanks for giving me your time today.